Dorothy Wigmore, and in the slides that I provided up front, Dorothy has her own website, and she captures a lot of information, a lot of useful information around advocacy and other information as well. So I'd recommend that you look at Dorothy's website. But now I'll hand you over to Dorothy, and Dorothy's going to talk about cleaning for health, not theatre. So over to you, Dorothy.
Thanks very much for asking me. As Kevin said in the little bio, I tend to rant about this subject. So it's one near and dear to my heart, and it actually has been since long before the pandemic. I'm an occupational health specialist, and I will hopefully take you through some of the arguments about whether we're cleaning and whether this is theater. So first off, I just want to clarify, make sure everybody's on the same page. A cleaner is either soap and detergent or with water. And with friction, it removes germs, dirt, impurities and from things. Cleaning has to be done before you sanitize or disinfect. A sanitizer removes bacteria to levels considered safe for public health. It's less effective than a disinfectant, and a hand sanitizer is really a disinfectant. It's a misnomer to call it disinfectant. Disinfectants destroy almost all, and it's like 99.49% of infectious germs, including viruses. They don't have any effect on dirt, soil, or dust, and they have to be used at the right dilution, left on glistening wet for the right amount of time. In Canada, they're regulated as drugs with DIN numbers. And so technically, there are no WHMIS data sheets or labels required. In the States, they have different rules. Most of them are regulated as pesticides, and they do require some information on data sheets and labels. The key thing here, as someone I know says, is you can't disinfect a dirty surface. So I just also want to, this is one of my pet peeves these days, sanitizing is a phrase we keep on hearing when people really mean disinfecting. And that's whether it's in the Globe and Mail, this Safe Clean Canada site. There's this Paul Davis company, which is a local one where I live, talks about exceptional cleaning and sanitizing, then goes on to talk about disinfecting. And even the government of Manitoba, where I used to live, seems to be confused about this. So the message we still get these days is clean and disinfect. And it's whether you're looking at sorry, I'm not quite sure why this is moving the way it is. Whether you're looking at the Public Health Agency of Canada's website, where they talk about both at the same time, that's the message we're getting. But we know historically that disinfectants are misused and overused, often prescribed by folks who I think don't consider the hazards and the consequences and what else might work. And they're also in this pandemic, whether you look at Canada, the States, or Europe, calls to poison control centers have skyrocketed, as have false claims about foggers, which was being used in the Toronto school, shown in the photo. Speaking of schools, and Jane MacArthur was part of this, if I remember rightly, the Greater Essex, I actually got Greater Essex County, sorry, I got the wrong one here, it's Windsor, Essex. There was a big fight there about using a product that contained what they call quats, and I'll talk about that in just a minute. But one of the things that we kept on hearing about was we're using it according to the manufacturer's specifications, and Health Canada says it's perfectly okay. So we believe it's being used correctly and it's appropriate. And there were a variety of parents who thought this wasn't quite the case, as did I. So people may have heard this term hygiene theater. It first came out in July of 2020, a guy writing in The Atlantic. And what it came down to is essentially, this is all for show. It's not doing anything very much. We would see people spraying streets, They would be wiping away in this one down at the bottom from a place in Toronto at an event, in gyms, those kinds of things. People were even wiping down groceries. And as Emmanuel Goldman, who's a microbiology prof in the States, said to CBC and all kinds of other places, there is not a significant risk for catching this virus from a surface. In fact, depending on what studies you look at, to the best of my knowledge, there's only been one in the whole world about an outbreak related to the virus on a surface in the whole pandemic. So it should have not been quite so long, but it took until April 5th of this year for the US CDC to come out and say, oh, guess what? If you use soap and detergent, that's going to probably be enough. And they updated it again in June to say that when emphasizing that when there aren't people who you think were had COVID or suspected did in a place, cleaning once a day is usually enough. However, they refer to a list that contains a lot of nasty products. So this is a graphic from the Tools for Informed Substitution toolkit that was mentioned earlier. I just want to remind folks that cleaners and disinfectants are linked to a lot of hazards. Short-term effects range from stuff on the eyes, the skin, dizziness, headaches, nosebleeds, you can get a sore throat. But studies show that depending on what ingredients we're looking at, there's asthma, can trigger asthma attacks, there's effects on all kinds of parts of the body. There are endocrine disruptors in these chemicals. Some of them lead to cancer and cardiovascular problems. And just to sort of make clear, we're not just talking, we're talking about a whole lot of people. There's a 2019 study here linking various what they called cleaning, but they really meant cleaning and disinfecting ingredients with respiratory diseases for a wide variety of jobs. I also want to point out, this is from our toolkit, that no smell is a good smell. And in fact, the smells tend to, the fragrances and whatnot tend to cause irritation. And some of them actually are also endocrine disruptors. And just around asthma, this is from California, it's from 2014. But what's important here is that their work-related asthma prevention program looked at asthma and cleaning products. And they found 11% of asthma were related to cleaning products. But what's important here is that only 20% were amongst the folks who were actually doing the cleaning. And the rest were people who were around and in the spaces where the cleaning or disinfecting had taken place. Healthy Cleaning and Asthma Safe Schools is a great resource for anyone who wants it. So I just want to talk briefly about one of the most common ingredients in disinfectants and cleaning products, in fact, and they're called quaternary ammonium compounds, or quats or quacks. They're found in cleaning products, disinfectants, antibacterial hand soap, eye drops, and more. These are some of the common ones. And I've circled on here, on the product label, you will find the active ingredient. And so what you're looking for is something that will say benzyl ammonium chloride or something like that. Like bleach, they're asthmagens. They have a lot of other health effects. This graphic summarizes some of them. As I've said to people behind the ubiquitous barriers in grocery stores, it screws around with your, can screw around with your reproductive system, their cardiovascular issues. There are a whole lot of things to do with this substance. It's if they come with smells or perfumes, those are likely toxic too, and yet they're being approved for use. Now, the Healthy Building Network, an organization that's based in the States, has something called the Pharos database, and they use what they call a green screen which comes from an organization called Clean Production Action. And the idea is that if you've got a benchmark 1 in the assessment that they use, that you really ought to not be using this stuff. Benchmark 4 is okay. And here's what happens when you look. They looked at, and I just picked some of the quaternary ammonium compounds. One of them, one of the most common sort of grouping is benchmark 1, which is like, don't use it because it's got all kinds of health effects. And this was another one that was in a common product. I think it might have been in a Lysol, but I won't swear to it. Was what they call a list translator, but it's probably benchmark 1. And in fact, these chemicals are so nasty that in California, their biomonitoring folks have unanimously put them on the designated chemical list. And if people want, there are 2 references there. So I briefly want to talk about informed substitution, because if this is a problem, what are we going to do about it? So the idea with informed substitution is you're going to get rid of stuff, as Phil is doing in the graphic here. The idea is it's more, we've got a right to know, that's great. But if we want to, once we find out, we need to be doing something. And so informed substitution gives us an approach that says we want to use something that's known to be less toxic or non-toxic, whether it's a different ingredient, a different method or tool. And actually, it's required in some health and safety laws in the country, the best one of which is British Columbia. The principles for applying it, pretty straightforward. We're trying to prevent people getting sick and hurt. We prefer precaution rather than waiting for something to happen. When we find hazards, we look for solutions that eliminate the problem, not ones that just limit the harm. And it answers the question, is it necessary to use this, to have this ingredient, that kind of thing. And so here's an example of what we did in the toolkit, where we looked at this graffiti remover. We discovered that using this green screen approach, that it really was benchmark 1. And guess what? It had 5 ingredients in it that were on the IARC cancer list. There were other reproductive effects. And of course, we were able to find whether it was Eco-Logo, Green Seal, or SF approved, which is the San Francisco Environment Department options. So what are the benefits of informed substitution? Basically, people don't get sick. There's less harm. Healthier workers that can show up with less sick time and absenteeism. Fewer hazards for outside, for communities, fewer costs, and improved practices within organizations or companies. And the graphic here is an example, is the audit form that we designed for joint health and safety committees to use to try and look at for nasty products they might want to get replaced. And the other thing we tried to do was to tie it in the health and safety work into procurement. And so people often in organizations find they've got something called a green purchasing policy or procurement policy. And it should reference these so-called third-party eco-label standards. I'll name some of them in a minute. Designate staff to manage this allocated budget and link to the Health and Safety Committee and the Health and Safety Program, so that, as our favorite dolphin here says, it looks great for everybody. And you need benchmarks and reporting requirements. So if disinfecting is needed and we're looking for informed substitutes, what can be done? Well, early in the pandemic, these folks at the University of Washington put together a handout. I happened to work on it. And the things they recommend are ethanol, isopropanol, hydrogen peroxide, L-lactic acid, and citric acid. The folks at the San Francisco Environment Department are basically on the same page and say that products cannot contain these quats, these quaternary ammonium compounds, or another group of compounds. And there's a Cleaning for Healthier Schools material that a friend of mine worked on that basically says, don't use the quats, and there are things like hydrogen peroxide products that are better. If you search the Health Canada database, you will find a lot of hydrogen peroxide products, but but I want to warn you that you don't want hydrogen peroxide with a quat, this benzalkonium chloride, and you don't want it with a peracetic acid, because the two together cause asthma or form an asthmagen. And then, you know, we don't always have to use chemicals. So there are these aqueous vapor or superheated dry steam devices that also clean. They're not the conventional ones. And they are very effective for cleaning and rapid sanitizing and disinfecting. Their kill rates are fairly high. This is information from Jason Marshall at the Toxic Use Reduction Institute. Electrostatic sprayers may or may not be okay. There's limited information about them. My main point here is you need an empty room, the right PPE, unlike this guy who's using this as, in the picture, the re-entry times, ventilation, and the product has to be registered for use in a device. Again, you have to use it with pre-cleaned surfaces. And the EPA and Public Health Ontario both have sort of weighed in on these, and it's sort of equivocal. The main message about foggers and misters, whether you look at EPA, which has something about this, or the Association of Industrial Hygiene, the American Industrial Hygiene Association, folks like me and Kevin and some others on this call, they're basically saying, don't use the stuff. Don't use these products. There's all kinds of health and safety issues with them. There's questions about whether they really work or not. And so there are guidelines for best practices for disinfecting. These are taken from a fact sheet that I helped develop for a school union in New Jersey. Whether it's using closed loop system to make sure you're not spilling or splashing, you have to clean, try using, be sure that you're using fragrance-free soap. Microfiber materials are great. Only target areas where and when it's needed. And apply disinfectants in unoccupied spaces with effective ventilation and re-entry times, full dwell time. That's how long it stays on. You want to go from the furthest spot to the door so you don't get trapped. You want to clearly communicate things around safe re-entry, and the employer has to provide effective fitted protective gear. Almost last but not least, the big question that I've had throughout this campaign is, we learned earlier on, we're supposed to wash our hands. Well, if we wash our hands with soap and water, and that's good enough for our hands, why is it not good enough for other things? So Jason at the Toxic Use Reduction Institute did some calculations on these. And he came up with, says, if you are 90% effective in your cleaning and your hand washing, you get rid of this virus at 99.99% reduction in the virus. The disinfection is going to give you 0.0099% more. So I would suggest soap and water and microfiber materials are good in a lot of cases. And if you're doing that, as Jason says, you're most likely, you're not going to be starting out with very much on a surface. If you do have to disinfect over time, we know that the virus viability decreases rapidly on a surface. You're not using harsh chemicals, and you can't disinfect anyways on a dirty surface. The California Department of Public Health, their work-related asthma prevention program, has some really important reminders about disinfectant use in schools. They advocate the use of microfiber cloths, whether it's on mops or just on the other materials, that only trained people use them, disinfect only when necessary. And very important is that, in fact, in California, it's illegal for kids to be, for disinfectants to be around kids or for them to be using them. And for those on joint health and safety committees, or if you're working in a school or you're a parent, I think that there are questions you should ask. These are inspired by Women's Voices for the Earth. What's being used? What are the products? And are there actually microfiber materials being used? Where are the data sheets for the products? And it means we want to see them. And certainly for staff and committee members, even though these are not covered by WMIS, they commonly do have data sheets. And if people are interested, California has a law now requiring the disclosure of all the ingredients in cleaning and disinfecting products. And I'd be pleased to talk to people about how you can track that down, because the US information often is the same as Canadian. Does the school or board actually have a green purchasing policy, and how is it connected to the health and safety program? And if you're going to have these third-party certified products, the ones that are the best are the EPA's what they call safer choice, the San Francisco approved list that I mentioned earlier, and Green Seal or Cradle to Cradle. Eco Logo, which is a UL kind of equivalent to Green Seal, allows quats. So I cannot in all conscience recommend Eco Logo products that allow quats. And once you find out whether you know what's being used and if there are less nasty stuff around, you want to make sure that only those kinds of products are used. And how do you do it? So let's stop wasting money and require cleaning the air, not surfaces. That I think that hygiene theater is bad enough, but our health and antimicrobial resistance are also at stake. Thank you.
Thank you very much, Dorothy. And you know, you go into shopping malls and other shops and places, and you see this kind of obsession with cleaning. It's ridiculous, you know. And thinking about, you know, transmission from fomites,
Yeah.
I think that I'm hearing it's like 1 in 10,000. It's really, we're focusing on the wrong area.
And that's probably even more than is likely happening. I just very briefly, if anybody's interested in talking to me, I'm writing a book about workers' experiences in the pandemic. And one of the stories I included in the cleaning chapter that I just worked on is I went into a local LCBO, and people, they automatically, the poor cashiers are expected to spray a surface, even though it's the bottom of the bottles that are the only thing that have touched the counter. My hands haven't been anywhere near the counter. And when I tried to talk to some of these people, and I said to the last time I was in, I said something to this guy, but why wasn't he doing that? And he said, I'm getting tired of doing it. And I said, well, you know, it's probably just as well. I looked at the bottle and I said, hydrogen peroxide, that's great. At least it's not the stuff that's going to screw around with your reproductive system. He says to me with a grin, my wife will be happy to hear that.
Thanks, Dorothy. And I know Jim's, you know, had dealings with asthma foundation, allergy foundation, just thinking about, you know, quaternary ammonium compounds. But I just want, we've got very little time left. We've got 8 minutes, and I was hoping that people might want to stay on and we can tackle more of the Q&A. I just wanted to, there's a really pressing question here, actually for Jim, but Tracy Edwards has also provided something in the chat box too. So I just say what Tracy's put in there, and then I'll refer to the question by Jim. So Tracy said that the Ministry of Education in Ontario has required each school board to post a ventilation measures report on their website, and this is the guidance memo they sent to school boards this year outlining which classrooms require the standalone HEPA filtration units. It sounds like there's a reason to celebrate there. That's what I'm sort of gathering from that comment from Tracy. Now I'll just go to, and if you want to show yourself, Tracy, and quickly make note of that, add to that, please do so.
Yes, I should say that that might be better than the comment from Lynn that they did not allow any of these portable air units in the classes. So Ontario might be a little further ahead of where she is, but we are still pushing for more. They're not in every single classroom across the province, and the school boards are very resistant to putting anything in there that isn't CSA approved. So maybe we can try to get someone from the CSA to look at those Corsi Rosenthal filter systems and say that they are not hazardous, and at least get some of those in the classrooms as well.
Great, thanks. I mean, we have a coalition that Dorothy belongs to as well, and there's a guy called Stefan Bilodeau who's really been pushing for these as well. So it might be something that we can talk to the coalition about. So then the question for Jim, you if I can find it. Question for Jim. The school board where I'm at, that's from Lynn, and I guess she's not in Ontario, I presume. The school board where I am at has stated that school HVAC has been upgraded to MERV 13 in all schools where possible, and they have extended runtime schedule. They have refused adding air purifier in each class, viewed as unnecessary. Is this true? What questions should we ask the school? Number of air changes per hour, carbon dioxide levels in each room. Here is the info they make. So she's provided a link. There's a kind of a few different questions in that bigger question, I suppose. Have you got any thoughts on that? The fact that they actually ask, they require MERV 13 filters in all schools. So if you've got MERV 13 filters in all schools, that's cleaning the air to some extent, isn't it? I don't know if you want to make it out of that or just comment on that.
Can you hear me okay or not?
Yep.
Okay. I think that's a good point. It's cleaning the air to some extent. The problem is, as I talked about, it's flow. So if you're only depending upon the central HVAC system, you don't have the continuous flow that takes care of viral particles that are in the air constantly. If somebody is sick and they are emitting those, it's a dynamic issue. So how often does that system run? Does it run? That's supposed to give 6 ACH and MERV 13. Is it running all the time, or is that just an optimal? When everything is perfect, that's what's going to happen. How often does that really happen during the day? The thing that bothers me is that why not do it? Why not have the extra step? That's really the issue is that we know it's going to reduce particles, and we know that COVID is airborne, and we know that it's going to eliminate some of those particles. So it is irritating. I know, and it's hard to keep motivated because every time you make a suggestion, there's some response that doesn't really totally answer the question, but it seems to make certain people on the school boards happy. So on. Let me ask a question. Is Quebec still making it so there are no HEPA air purifiers in the schools? Is that still the procedure there? Does anybody know?
Just trying to think, we may have somebody on the call from Quebec. I know Marc-Andre Lavoie. He's based in Halifax at the moment, but he's from that area. I don't know if you know Marc-Andre, what's happening in Quebec. Sorry to put you on the spot.
Yeah, and maybe somebody can work on that. But there was a question about CO2 versus air cleaning.
I'm glad you raised that because it seems that that's the way people are going, like monitoring for CO2. You kind of see big monitors, overseas of these international events, and they sort of showing the CO2 level, and they kind of, it's like green, amber, red. But yeah, if you could comment on that, that would be great.
I think people need to understand it because CO2 and air filtration are not related. You can have a MERV 13 filter, you can have a HEPA filters in the room. You're not going to reduce CO2. What CO2 does and why it's important to monitor it, it's the alarm system. It tells you when the ventilation is not sufficient in the room and you need to do something. You need to open the window or open the door and put a fan in the door to try to increase circulation and ventilation. And that's when you would use the standalone air cleaners. That's the sign. You get a CO2 of 1200, and that's a good indication you need to be doing something supplemental. That follow up to that?
Yeah, and I guess just to add to that, there's a colleague of mine from Australia. Her name's Kate Cole. She's either the president-elect or she's now the president of the Australian Institute of Occupational Hygienists. So she has an AirNet CO2 monitor that she puts in her handbag, actually. So when she goes out shopping or wherever, it just gives her an indication of what the CO2. It's like another tool in the toolbox to show where the air quality is poor.
Like
You've
this.
got one, and I've ordered one, and I know Val's ordered one. But anyway, just
Have them all
so-
over the place.
yeah.
My
Val,
wife-
did you have any questions? Did you want to pick a question from the chat box at all?
Well, Neil had a question about using CO2 as the with a target number. We had a bit of discussion about the target number. 700 is a target we use, but I think Jim's answer maybe has already. Is dilution the solution in all cases, or should we capture and filter? And I think that's exactly what you're saying, Jim. Is that so yes, the CO2 is a marker of exhalation accumulation in the room, but because of the risks of COVID particularly, we should be filtering when there's people gathering together where it's feasible and possible.
Yeah, and if I could just add to that,
Yeah.
with the, that Harvard Healthy Building, that they set out a whole sort of algorithm for people to follow. But they're essentially saying, if you reach a certain level of fresh air, or you don't drop, or to go above a certain level of CO2, then you don't need this auxiliary room level filtration. But I know when we're dealing with toxic substances, or even in hospitals with infectious diseases, we wouldn't rely solely upon general ventilation, right? So for me, I think you kind of did answer it. You're like, well, why wouldn't you do that, right? Like I'm seeing, like in the filtration side, why would you not go higher than MERV 13? It doesn't cost much more. Pressure drop isn't really there. Creating a box, this Corsi box, fan box, there are solutions there that will add this extra layer of protection. If we really believe in the Swiss cheese model, then why wouldn't we do that, right? Because it's an imperfect, the CO2 aspect and the general ventilation is imperfect.
Yeah. So the MERV 14 versus MERV 13, it really goes back to the supply issue. MERV 13 you can make pleated filters. MERV 14 you can't. And there's simply no way to make enough filters to solve the problem. MERV 13 was 5% of the market. MERV 14 is probably 1% of the market. So it's just not available. Is probably the best answer. If you have if you have the capacity and the system is set up to run MERV 14, by all means do it. By all means do it. That's what you have in hospitals. It's actually a 3-stage system. It's a pre-filter that's usually a MERV 8 or a MERV 10, followed by a MERV 14 filter, followed by certain areas HEPA filters. So yeah, if you could do it, do it. But in most cases, you can't do it. So it's a matter of having the ability to do it. And there aren't MERV 14 pleated filters to speak of. There are probably a few exceptions, but essentially they're not available.
Thanks for raising that, Neil. And I see just in the chat box, Tracy Edward just put a comment here. Quebec is putting CO2 monitors in classrooms, but we haven't been able to implement that in Ontario. So I shake my head when I read that. It's very disappointing, isn't it? But I'll just leave it there. So I might just throw it back to you, Val. Are there any other questions, or did you want to have any other comments as we sort of move towards closing out?
Yeah, I think, well, there's a few things. So I see Lynn asked if she could explain her question. I actually have a question. So Lynn, we can put you next, I guess, if you want to unmute and ask the question. There is also a comment with respect to eye protection and the cleaners for you, Dorothy. And I wanted to ask about the height of the Corsi Rosenthal boxes, because we did make one. We've got one, a 5-sided one on a wheeled you know, like that a dolly for moving, so that we can move it around the house quite easily, which is great. It's R2D2. But my husband did make some, they made some for their church, and recognized that when people, because people in some churches are going for communion unmasked and just for the communion part, and they've positioned them at a higher level, at the breathing zone of the people, which makes sense, right? So that was part of the dialogue of how do you position them, and should they in schools be positioned at the children's height, breathing height, or higher? I guess if you have any comments on that.
Well, I think what I'm seeing is that the biggest worry is that children are going to come up and touch the filters, or some way interfere with the box. And what I'm recommending is that you do put it on a table or a desk or something, so that it's not right there on the floor where some 5-year-old can go over and touch it. I don't think it's a huge danger. Just as we talked about, the fomites are not where it's coming from. Low probability that that's where you would have a problem, but for peace of mind, it probably helps to just make it so that it's not accessible. And as far as where it would be in terms of effectiveness, I just did a test, and what I've seen over the years, and I've been doing the HEPA air purifier for longer than filters actually. What I've seen is that once you have a unit running in a space, you're going to have pretty much the same particle count through the space. There's a lot of air movement. You don't think about it, but there's a lot of air movement in the space. And what I did for this test, I have a tool room that's 20 feet by 28 feet. I took one of the boxes, put it about 4 feet away from the wall, but in the corner. Turned it on. First I did an ambient particle count in all 4 corners, and then went back after the thing ran for 2 hours, did a particle count in all 4 corners again, and essentially had the same numbers for all 6 particle sizes. So what that would tell me is that if you have it up in the air and it's moving air in that space, it's going to do the job.
Great, thanks.
Okay.
I don't know if Lynn is here.
Yeah, I'm still here.
Great.
Hi. 2 things. I posted stuff in the chat for Quebec. My niece just started as a brand new teacher. And basically in the schools where they didn't review their HVAC, they have no HEPA filter, as far as I know, no CO2, and they're basically counting on opening the windows throughout the year. So that's her situation. And then the question for Jim, basically I was responding because there was an article in our New West newspaper where the one parent was concerned about wanted to do crowdfunding for HEPA filter for each class to make it equitable, and was turned down by the people responsible for HVAC in the school, and basically stated point blank that they weren't required and they were of questionable benefit as they considered the complexity of ventilation and airflow across their multiple spaces in the school. And they gave a tracking record just saying that they were using MERV 13 in that particular school, and that they just had extended the running schedule for the HVAC from 6 a.m. to 5 p.m. But there's no mention of CO2 monitoring to see what's the airflow in any of the spaces or classes. I don't get the sense that we know how often the air is being exchanged, as you were pointing out. So I'm wondering what is what would be a good articulated response to say, hey, can you give us this information?
They should be able, if they've done ventilation balance studies, they should be able to give you the statistics for essentially every room in the school.
Okay.
Most of them have not. And I'm speaking from U.S. experience, but I've been surprised over the years at how poor the ventilation is in school.
Okay, and the statistics would be the number of air exchange, and if they've measured the CO2 in each room to see how much airflow there is.
Well, the CO2 is, you have to have the people in the room. That's the problem. You can get any number you want. I can get great CO2 numbers if I go in on Sunday.
Right.
I could have, everything is 450 because nobody's there. And that's one thing that if you're looking at the literature of any maker of an air cleaner and they're giving you a test, try to determine what the test is. I wrote an article for my website and I took a green banker's lamp and proved that it was a fantastic air cleaner just by measuring the particles when I determined I was going to measure the particles. I tell people I can give them any number they want. Just let me decide when I do the count, and I can give you any number you want. And it's the same thing with CO2. So it's got to be classroom in operation, normal number of people, whether or not you're getting the proper levels of CO2.
The other thing that I would add, and Jim, I'm sure that you pay attention to this too, the work I've been doing in US schools, one of the questions that's come up is about the dead spaces. And how air changes per hour are great to know, but that is sort of an overall kind of picture in some ways. And certainly with the indoor air issues that are common in older schools, people complain about, stuffy spaces and things like that. So I would say that it would be good to know whether they've, what complaints they've had about stuffy air and the quality of the air in the school, because if that's been happening, if there's a pattern there, then it's not just air changes an hour that need to be looked at. Perhaps there may be more going on.
Right, and you mentioned the dead spaces in the air, and one thing I'll comment on is that any schools that have plexiglass, you are creating dead spaces in a classroom with plexiglass. There was a study done about 3 months ago, and they're trying to determine how successful any of the mitigation measures were in controlling COVID in the school. And they found that masks were great, vaccination when it was possible was great, MERV 13 filters were great. Plexiglass actually was negative. The spaces that had plexiglass in the school were more dangerous than not. So dead spaces are huge.
Yeah, and I say to people at the grocery store who are behind them that, the only thing, or in my credit union where they're not wearing any face coverings on the other side, and I'm, I sort of say, well, if I was smoking a cigarette, could you smell it? Despite this, and all it's doing is stopping me spitting at you, which is a good idea. But and I can't punch you either, which is also good. But it's not doing what it's your people are bragging about it doing. So
Tell people it's good for stopping hockey pucks.
yeah, that too.
That's about it. It's not very helpful.
Yeah.
So we might move on. I just had a comment also about CO2 monitoring that came to my mind. User beware. It's not just a simple thing of putting a CO2 monitor out and just reading the number. You've got to be very careful about how you interpret that. We breathe out CO2. You've got to think about where you put the monitor, and you've also got to think about if you monitor CO2 when there's nobody in the classroom, what's the point? But there's a lot of complexity, and quite often, we may oversimplify this, but it's not that simple. But it is very important to monitor CO2. I just wanted to make that caveat.
I saw a couple of other questions here. There was another one about ventilation and the MERV rating from Mark.
It's Neil's question. I think we covered that.
It's from Mark.
Oh, that was Mike Andre Lavoie that he was feeling inspired, maybe. But
No, this is Mark Crofts.
No.
Are employers focused on hygiene theater? The Joint Health and Safety Committee asked what MERV rating our HVAC filters are. They won't tell us. Any suggestions?
Workers.
Yeah, I mean, the problem is that, you know, people are going to be up against brick walls out there. And we don't really know how they gonna how to get them over that brick wall. I guess all we can do is just use the information that's shared in these webinars to try and influence those that we can influence. So, for example, you know, if everybody on this webinar was to go to Canadian Tire or, you know, Walmart or somewhere else and buy the material, Home Depot, buy the material, build a Corsi Rosenthal box, take it to their school, donate it. It's just about spreading the message. I think that's all we can do here, is just influence those that we can influence with the information that we provide through OCAP. I don't know if anybody else has anything to add to that.
Well, certainly I would say, if Mark, if you've got a union, that's another way to have a collective voice on this, and maybe a bit more power than the Joint Health and Safety Committee folks have. The other thing I'd be asking for, just while you're looking at MERV filters, is when were they last changed? Because all the filters in the world won't do you a whole lot of good if they aren't changed often enough. But
Health and safety committees do have the right to information about what they're exposed to in the workplace. That's part of the internal responsibility system in Ontario. So how you dialogue about that at the committee level, and it depends on, because it's better to dialogue than to be challenging, but you're also entitled to inspect the entire workplace once a month. So one day the inspection could be in the air handling units, and you can ask questions. Although I do have to say, it is very challenging if your organization does not own the building, because getting information from landlords, we understand, has been quite difficult for organizations. So that's another layer of resistance, shall we say. But anyways.
Just also to add to that too, you know, I was in, and I'm not sure what the process is in Ontario, and I was an inspector in Newfoundland. Anybody could put in a complaint to the inspectorate, and they had to follow up on every single complaint. So that there should be a mechanism where you could put in a complaint, and you feel that if you feel like you're not being heard, if you feel like you're not being heard.
And Val, you said there was a question earlier about eye protection.
It was a comment more around, but it was not that long ago. I don't think that someone talked about, peroxide and the other materials should be used with eye protection, although I've never seen eye protection used by anyone using cleaning products. So it was sort of a comment that it's not commonly addressed.
And that's why I said that, you know, whatever you're in the various protocols and best practices, that employers are supposed to provide the right gear to protect you. And, you know, it's supposed to be on the label what it is you need. And certainly it makes sense that the gloves and eye protection are pretty basic for this stuff. You know, the lower dilutions, you know, are not going to be as nasty as the concentrated stuff that people are trying to dilute stuff, and not using what they call a closed loop system that avoids the spills and things. But yeah, basically, and especially if anybody's, you know, going beyond. Oh, the one thing I didn't say was that rather than spraying in the air, which just sort of tends to add things to the air, if you really want to clean or disinfect, you spray onto like a microfiber cloth and then use that. You know, all this spraying of grocery cart handles isn't doing a whole lot of good if you look to see if you actually want to take anything off, and they're spraying only disinfectant without cleaning ahead of time also. But you know, that's where the microfiber cloths can be really handy.
I think we probably should close out at 3:30, so we could probably leave it open for 10 minutes if that's okay. I'll just thank Jim once again, and the other speakers, Danielle and Melissa and Andrew and Dorothy. And I also just want to let everybody know that the links to our last webinar, the slides to our last webinar, are now up on our website. So thanks so much for organising that, Varney. And also just want to talk about the next webinar on the 1st of October. We've got Jose Jimenez, which is fabulous. And we've also got Dr. Yunir Baryam from the New England Complex Systems. He's also the leader of the World Health Network. And we've also got Peter Smith from the Institute of Work and Health. So that's on the 1st of October. And I might just now hand it back to you, Val, if you want to have some closing words or.
Thanks, Jim. The reason I wanted to just say something was to acknowledge the loss of Dr. Catherine Lapel yesterday, who was a champion of worker health and safety in Canada, and a loss to us all. She was a researcher and an activist. She was the first and so far only Canada Research Chair in Occupational Health and Safety Law for 10 years at the University of Ottawa, and she was a friend to OCOW, assisted with our workplace mental health efforts over the years, also with vulnerable workers. She's spoken on several of our webinars like this, one last January on disease in workers, and one a year ago, May, on workplace mental health and comparisons between Quebec and other parts of Canada. And she was very expert at bridging and helping us find, learn from each other where things worked from a regulatory perspective, as well as from other aspects of health and safety, culture and activism. So I just wanted to acknowledge her loss, and because it is a big one. We also, I don't know if anybody else who's on the call still knew her or has any.
The other thing that I would just say is that I met her through back in the early 90s, when there were various meetings around women's health and safety, and she did all kinds of work with folks at University of Quebec and Montreal and the group Symbiose before she was at U of O. And so she was working with Karen Messing and Donna Mergler and others. And so for me, when I think of her, I think of her in that context as well. And I can, as I said to somebody yesterday, I can hear her voice and see her face, and her, she's just was a very special person. And the other person that we both know that died yesterday was Dave Durma, who also played a unique role, I think, in occupational health and safety research. And I think of him from my Sudbury days and the work he did around mining hazards and workers' health there, but he did a lot more.
I remember when I visited Canada from Australia and I was doing my research at the time, Dave was actually in a mentor role with the WSIB, and I asked if he could give me some advice, and he gave me lots of time. He sat down, he talked through the research I was doing. So he's a great notable person here in Ontario and a leader in the field in occupational hygiene. So his passing is sad as well.
Mm-hmm.
And he was, of course, a mainstay at the McMaster Occupational Health Occupational Health Program, which ran for several years and trained many of us who work at least in the Hamilton Clinic at OCOW, and also the lab too. He was responsible for, which did a lot of independent testing that helped a lot of workplaces as well. So a big loss for the health and safety world yesterday. So didn't want to let everyone go before at least acknowledging that. So, but we will carry on, right, and learn from all that they taught us and try to make a difference in workplaces and for workers in Ontario and across the country and around the world nowadays. So I think that thanks for everybody who joined us today. And we do hope that you come next week. I think it's going to be a great conversation about, it's kind of using COVID from an occupational disease perspective, but then extrapolating what we learn or have learned and continue to learn around other occupational disease prevention, which is still so needed since it's so under-recognized.
And just back to Jim too. We really are grateful for your time, Jim, and to share this great innovation of yours. And now we can do something with that. I just wanted to finish off with that one too. Thanks again.
Well, Well, and Andrew and Melissa too. I know there were some comments privately and emails and also on the chat that it is very valuable information and for all of us in terms of ergonomics and also to be more conscious of kids and screens and other health issues that can arise with this sort of hybrid education that we're all working our way through. So.
And just taking what Danielle shared too, you know, with better masking, better respirators for children, you know, with what Danielle presented and also Jen McDonald presented last night, Dr. Jen McDonald, we can do something about that. You can actually buy KN95s from Costco, by the way. You can go buy a box of KN95s and you can actually get KN95s for children, I believe. And there's also Canada Strong Masks is something I think they're making
Specifically
respirators
designed
for
for
kids
kids.
as well. Yeah.
Take care. Thanks again to all our speakers.
Thanks again.